Hello, and as we begin week 2, we'll learn about the health and medical benefits of a meditation practice from Dr. Patrick Massey. We'll also extend and review our meditation practice.
Well, first off, I want to welcome everybody to the lecture, and I hope that you will be getting some good information about the importance of meditation. The second thing is I would like to thank Karen Baker and the Delta Foundation for actually making this video a reality. For those of you who don't know me, my name is Patrick Massey. A little background on me is I have a PhD in immunology from Northwestern University Graduate School of Medicine. I got my MD in medicine from Rush University, and I did my residency and internship at Rush also with an emphasis on internal medicine. I later went and spent a 2-year program with Andy Weil out in Arizona for integrative medicine, and after that went and got a doctorate in metaphysical studies at Delphi University in McKaysville, Georgia. And metaphysical studies deals to a great extent with meditation. I am board certified in both internal and integrative medicine, and currently have an ongoing medical practice in Elk Grove. Now that we got that out of the way, we can get on to the really important things. Why meditate? What is the reason for meditation? Many of my patients will ask me, why should I meditate? What is the purpose of it? And there are really, in my mind, there are two major reasons for meditating. One is somebody is interested in what I call New Age woo-woo stuff. And this is the things that you do to discover yourself, to connect yourself with the universe. These are involved with spiritual and religious discoveries, possibly. And this is a very good reason to want to meditate. But I'm from the Midwest. And people in the Midwest, although they like the New Age woo-woo stuff, it's really not putting biscuits on their table. What they're interested in is they're interested in tangible benefits. And really one of the most tangible benefits of meditation involves your health. Meditation has a profound effect on reducing blood pressure, on balancing blood sugars in diabetes. It is wonderful therapy for anxiety, for depression, for ADD, especially in young children, and PTSD. It's absolutely wonderful for the bowels, and we're going to be getting into some of the studies for this. It has a great effect against the number one reason why people actually seek out medical care, be it traditional or be it non-traditional, and that's pain. It is probably the only therapy that we have for the prevention of Alzheimer's disease, and I'll touch on why that's important a little bit later in the talk. Heart disease and stress reduction go hand in hand, and meditation is a powerful tool in reducing stress and reducing the risk factors for heart disease. And sleep. All illnesses do worse if you're not getting a good night's sleep. I actually read a study just before this lecture looking at the fact that sleep deprivation increases the risk of Alzheimer's disease. So there are tangible benefits, and there are New Age woo-woo benefits for meditating. And it really doesn't matter which one you're doing it for. So if you're doing it for the New Age woo-woo benefits, you will ultimately experience the health benefits. If you're doing it for health benefits, you will start to experience some of the New Age discoveries and finding out that you had more than just 5 senses and all these other kinds of wonderful experiences that we have. So either way, you're going to get both. So meditation is really a universal practice. What meditation is simply a way to train and focus our attention or our awareness to be mentally clear and calm. And in today's world where stress is at every single moment of our lives, being mentally clear and calm is an absolute gift. It's a worldwide practice. It's in all religious practices. There is some form of meditation. Indeed, prayer is a form of meditation. It's in all spiritual practices. You can't really have a spiritual practice without having some form of meditation. And it's in many healing practices, both in traditional medicine and non-traditional medicine. Indeed, in traditional medicine, there are thousands and thousands of medical studies looking at the health benefits of meditation on many chronic illnesses and diseases. The photograph is a picture of a hospital in China, and the physicians in the white lab coats are running energy into the different energy centers in these two patients who are in very deep meditative states. And running energy into them during these states actually intensifies the meditative experience, both on the New Age woo-woo side as well as on the health benefits. Both of those patients came to the hospital not for New Age discovery, but for the treatment of chronic illness and disease. Every culture, not just the Far East, because we always think of meditation with Buddhist monks and sitting in a temple in groups and chanting, but every culture throughout recorded history has some form of meditation. And this goes back beyond Egypt. It goes back beyond Syria, not the ancient Syrians. As a matter of fact, even the Aborigines, the paintings on the walls in some places in Australia demonstrate that they were probably using meditative techniques in many of their practices. There are innumerable meditation methods throughout history, and so really it's impossible to say which method is better or which method is more effective. And really the main question, because humans are not very good at holding on to things that aren't important to them. If something is not important, we dump it really, really fast. So why is every culture throughout recorded history using meditation? And the reason for that is that there seems to be consistent, tangible results when using meditation. Now, these consistent, tangible results may be in self-discovery, okay, such as Buddhist monks in China, or it could be for health benefits that we are just really rediscovering. We are rediscovering this in modern medicine today. Meditation, in my mind, it can be broken up into two broad categories. One of them is individual meditation, where you're sitting by yourself or standing by yourself or lying down by yourself or doing something by yourself, and you're focusing on whatever it is that you individually want to focus on. There's another form of meditation, and this is guided meditation. Now, guided meditation can be broken down into different groups. You can have a group of people all coming together to meditate on a specific topic. So that would be kind of guided. Everybody's being guided to meditate on that. You could have what's known as guided imagery. Guided imagery is listening to somebody walk you through a meditation. Usually you're walking down a nice path and there's flowers on the side and there's butterflies and unicorns and there's always a beautiful lake and whatever else. And that's kind of a guided imagery, and there are many applications that you can get off the internet or you can buy, which take you through guided imageries. Which type of meditation is best? I have many of my patients will ask me that when I ask them to start learning to meditate, or I teach them how to meditate. They say, which one is best? Most of my patients are from the Midwest. They don't want to spend their time and their effort on something that may not be as effective as something else. And really the answer for that is whatever you will do regularly. So whether you will do individual meditation regularly, or whether you will do group meditation regularly, or guided imagery regularly, all of those will give you the same benefits, both health-wise and as far as self-discovery and New Age woo-woo things. So James Allen once said that calmness of the mind is the beautiful jewels of wisdom. And I agree with that. We live in a society right now where everything is under stress. Every time you turn the TV on, every time you look on the internet, there is nothing but stress and chaos everywhere. And even in our own lives, we get up in the morning, we go to work all day, we come home, there are things we need to do at home, we watch TV for about an hour, and then we collapse into bed. And at no point in time during that time does our mind actually have the opportunity to be calm and to be able to relax and to take the stress off. And so it's important that we have some sort of balance in our lives, and meditation is a very easy way of being able to do that. So how does meditation actually affect our health? And that's what the rest of this lecture is really going to be on. And in order to answer that, we actually need to look at the universe. The Chinese have been able to really describe the relationship that the universe has with itself in the yin and yang symbol that you're looking at right there. That yin and yang symbol was done by a very talented artist by the name of Mariella Nava Massey, my granddaughter. And what it shows is it shows that there's a relationship between two energies. And this is really the cornerstone of the universe. This universe, can't talk about other universes, but this universe was built on opposites. For every up, there's a down. For every left, there's a right. For every inside, there's an outside. For every atom of matter, there's an atom of antimatter. And our bodies are really no different. So when we look at this symbol, we can look at the red part of it, and this is what is called yang. It's traditionally thought of as being male, but it really has very little respect to gender. But the characteristics of that energy is that it's hot, it's dry, it's constantly active, it's bright, it's sunny. So these are the characteristics of yang. The other part of the symbol is yin, and yin's characteristics are the opposite. It's cool, it's moist, it's unmoving, it's dark, and it's female. Again, the genders don't mean what we traditionally think in Western thought. But there is a balance. Yang energy is not any more powerful than yin energy, and yin energy isn't any more powerful than yang energy. And you need to have a balance in order to have health in your life. Most of my patients, when I first see them, I would describe them as being about 85% yang and maybe 10 to 15% yin. That's a perfect combination for stressing out the body and causing a lot of illness and disease. So, why is meditation important? Meditation is important because meditation is primarily yin. Even moving meditation, such as Tai Chi, it's primarily yin. You're not really focusing on the movements. You're more focusing on the how the movements are putting your mind into a meditative state. The interesting thing in Chinese medicine, and I think the interesting thing in Western medicine, only we don't think about it this way, is that healing only happens during yin. So what does that mean? Let's say you're out riding your bike, it's a beautiful day, you hit a pothole, you fall off of your bike, you extend your arm, and you get a fracture of your forearm. The first thing that you do not do is something yang, like jump off your bike and start doing push-ups, right? The first thing that you would do is you would grab your arm and you immobilize it. You stop the movement. Then you cover it in a nice dark cast, which stops the movement, and it's nice and moist. So yin is the time when the body heals. Even professional athletes, when they are injured, they don't just immediately run to the gym and start lifting weights and doing training. They spend time resting and healing. Healing happens only during yin, and it's something that in this country we spend very little time in. So, meditation positively impacts all illnesses. And if you've never been to Montana, this is what part of Montana looks like, and it's very easy to sit there and become very, very calm in the realm of these beautiful mountains. So why meditate? There are many good reasons. One of them is to be healthy. And if you're healthy, you're going to be saving money because you're not spending money on medications and therapies and doctors and whatever else. If you're healthy and you're saving money, how can you not be happy? All right. And if you're healthy, saving money, and you're happy, you will probably live longer. And I'm going to touch on the reasons for that in a couple of slides from now. But the main thing is why meditate is that you get control of your destiny. You are in control of where you go and what it is that you want to do. The physiologic effects of meditation are many. You reduce stress hormones, the adrenalines and the cortisols. You increase the endorphins. Endorphins are not just feel-good hormones, but they also have a profound effect on how the immune system functions. They have a profound effect on how you heal. If you don't have a lot of endorphins, your healing is slow. If you have a lot of endorphins, your healing is accelerated. Telomeres are the tail ends of the DNA. This is where the enzymes that replicate the DNA, this is where they bind to, and they replicate the DNA. With each replication of DNA, with each time the cell divides, you lose a little piece of the telomere, so that over time, over your life, the number of telomeres actually drops down to 0. The cell is no longer able to replicate, and it dies. And then so do you. Meditation is able to extend the length of telomeres no matter where you're starting at. So if your telomeres are short and you meditate, they will become longer. If your telomeres are long, they'll become even longer still. Telomeres potentially could increase your longevity. If you have a lot of endorphins and you're feeling pretty happy, your relationship with yourself is going to be good. Your relationship with others will be even better. You'll be able to make better decisions in your life because you're not going to be feeling the effects of stress, and you will be enjoying life much more than if you don't. So really, where's the beef? Where's the evidence for this? Well, if we were to look at all of the medical research in the traditional medicine, all of the traditional medical research, there are thousands and thousands and thousands of studies over the past 50 years. This would be probably a month-long symposium, 8 hours a day, 5 days a week. I know you wouldn't want to be there. I certainly wouldn't want to be there. So we're condensing it. So I'm just giving you some sampling of where some of the evidence is. Okay, let's look at the causes of death first. Heart disease, almost 700,000 people a year die from heart disease. Cancer, 600,000. COVID-19, we're up to over 900,000 now. That number as a cause of death is going to change over the next couple of years. It'll go down. Accidents, 200,000. Strokes, 160,000. Chronic respiratory illnesses like COPD or chronic obstructive pulmonary disease and asthma, 152,000. Alzheimer's, 134,000. Diabetes, 102,000. I have highlighted Alzheimer's because out of all the causes of death in the country, Alzheimer's is the only one for which there is no therapy. So if you get Alzheimer's, there's nothing that can be done. There may be an out with meditation. Let's look at medications. So one of the reasons for doing meditation is to save money. Well, the cost of high blood pressure, 150 million people, is about $1,000 a year. Heart-to-heart disease, $30 million, $2,000 a year. This is just medication. This is not other therapies and things that you need to do. Diabetes, $5,000 to $7,000 a year, primarily because the cost of insulin in this country is 4 to 5 times greater than anywhere else in the technologically advanced world. Depression, $1,200. Anxiety, surprisingly, $7,000. And many of my patients, when I first see them, they're all anxious. Irritable bowel, surprisingly, $5,000 a year to treat irritable bowel, something that people don't die from. And then Alzheimer's disease, about 6 million people a year. And the only medication for which there may be a benefit, perhaps if you really stretch the data, that medication is over $30,000 a year at this point in time. So a little bit of meditation is going to save you enough money that you can take some really nice vacations. Let's look at heart disease and high blood pressure. It's a leading cause of death for everybody, men, women, ethnic groups. Everybody. One person dies every 36 seconds, and it runs about $363 billion a year, which is about half of the federal budget for our defense. So it's very, very expensive. Now, who's paying that? I'm paying that. You're paying that. Everybody here is paying that. Insurance companies don't pay that. The government's not paying that. We're paying that. So anything we can do to impact that dollar amount is going to be a benefit for us. So we know that for heart disease and high blood pressure, that lifestyle choices are major players, even more than genetics, and we've known this for about 50 years. Stress is a major player. Diet's a major player. Exercise, you can reduce the risk of heart disease by simply walking a mile a day. Again, going back to sleep, if you have poor sleep, your risk of high blood pressure, your risk of heart disease, and your risk of sudden death increases dramatically. And sleep is one of those things that meditation can have a real good effect on. So we're looking at sudden death, a study from 2021. The important thing here is something called heart rate variability. What that means is that the heart is able to respond rapidly to changes in the environment. So if you have high heart rate variability, you've got a very strong heart and your risk of sudden death is very low. If you have low heart rate variability, as many people with heart disease are, it means the heart can't respond and you're at an increased risk of sudden death. We're not going to really worry about the EEG so much. We'll put that off to the side. What they found in this particular study is that 8 weeks of meditating significantly improved heart rate variability. And when they took those numbers and they looked at that, the risk metrics in larger groups, they found that there was a significant reduction in the risk of sudden death simply from meditating. That's that whole living longer thing. In blood pressure itself, from the Journal of the American Heart Association, for people with established high blood pressure, this is a meta-analysis looking at a number of studies all combined together, and the evidence on this, the quality of the evidence was actually quite high. And starting at 8 weeks of meditation, they noticed a significant reduction in blood pressure across a number of different studies. So you can reduce your blood pressure just by doing about 10 to 15 minutes of meditation a day, which I think is really profound. I think everybody has about 10 minutes a day they can put off to the side for this. Coronary artery disease, it's very hard to measure the plaque in the coronary artery disease and meditation. I'm not actually sure anybody's actually done that, but what we do is we look at risk factors. And this is a program, a 6-week program, looking at doing some yoga and some meditation, looking at blood pressure, which was significantly reduced. It was looking at heart rate, which was significantly reduced. And interestingly, it was looking at BMI, or body mass index. So doing a little meditation, doing a little bit of yoga over 6 weeks, people lost weight. They didn't change their diet. If they ate potato chips, they still ate potato chips. This is important because when you're under chronic stress, your body produces a lot of a specific hormone called cortisol. Cortisol is a steroid hormone that makes you gain weight. The other part about this study is that the blood vessels themselves were able to get larger and to be able to increase blood flow to the tissues. Anxiety and heart health. This is a very interesting study because it was done over 40 years. And what they found is that, and they didn't really talk about meditation here, but this is important, is that anxiety in middle-aged men increases the cardiometabolic risk trajectories, which means their risk of heart disease increased dramatically in middle-aged men who were anxious for whatever reason. As they got older and they changed jobs or their lifestyle changed and they weren't as anxious, these trajectories didn't change from in an older age as to when they had the same trajectories when they were young, which means that they still had the same increased risk of heart disease, stroke, and death. So that means that the sins of our youth are played out as we get older. Meditation is excellent for anxiety. In diabetes, these are two different studies. One of them was done over a period of 8 weeks, and they noticed doing Buddhist walking meditation, and they noticed that in about 75% of the patients, their blood glucose levels fell into the normal range. These were type 2 diabetics. They were on medications, not insulin. The other study looked at 6 months of meditation, meditating once a day for about 10 to 15 minutes. And what they found, again, is about 75% of the patients, their blood glucose fell within the normal range. They were off of their medications. Their hemoglobin A1C, which is a measurement of blood sugars over 3 months, most of those, again, about 70 to 75% of the participants, those levels fell into the normal range, and their fasting serum insulin levels also fell into the normal range, indicating that meditation can actually reverse, to a great extent, type 2 diabetes, meditation alone. Low back pain, this is one of my favorite articles done in the Journal of the American Medical Association, was looking at mindfulness as a meditative technique versus cognitive behavioral therapy versus usual care for people with chronic low back pain and serious chronic low back pain. 8 weekly sessions means once a week for 8 weeks, people either did 20 minutes of meditation, had 20 minutes of behavioral therapy, or had 20 minutes talking to a nurse. And what they found is that the people who had the meditation had a 43% improvement in pain. Those with cognitive behavioral therapy had 26%. So meditation was almost twice as good as cognitive behavioral therapy. And this is the important part. The improvements after the sessions were over, the improvements lasted for a year. And that's quite significant, even to the point where the editors said that this may be an effective treatment option for patients with chronic low back pain. I have found very few medical therapies for low back pain that actually incorporate meditation, unfortunately. Irritable bowel syndrome, I chose this one because it was in children. Children have a lot of bowel issues. As a matter of fact, it's one of the main reasons why they go and see pediatricians. And what they found is that by doing some meditation once a day for about 15 minutes, that they had significant improvements. Now, children take to meditation like a duck to water. Within 10 minutes of meditating, they have got it down. They are experts. They are firing on all pistons. And what they found is that for pain and anxiety in this particular group, 98% of them had significant improvement in pain and anxiety, and almost 50% of them resolved. They never had the pain again. This is the important one. This is Alzheimer's. If you look at the word cortex, that's also known as the gray matter. This is where your nerve cells are actually at. The white matter is the extensions of the nerve cells going to other parts of the brain and going down the spinal cord. So a normal brain has a lot of nerve cells. It has a thick cortex. And when you look at an Alzheimer's brain, what has happened here is that the nerve cells have actually died and they're not coming back. There's no way of reversing that. There isn't a pill, a medication, or a therapy, including meditation, I think, that can reverse that. So for Alzheimer's, prevention is the key. And this was a study done in 2017 in the Journal of Alzheimer's disease. Again, this was a meta-analysis looking at 13 studies using a wide variety of meditation techniques. And the patients, the participants were older individuals, and they were meditating for about 15 minutes a day for 6 months, up to a year, up to 2 years. And what they found is they did MRIs before the meditation to get an indication of how thick their cortex was, how thick the gray matter is, how many cells they have in their brains. And then they measured it at the end of the study. And in every single one of the studies, there was a significant increase in gray matter volume. This is important because if you want to prevent Alzheimer's, you've got to have as many cells as you possibly can, because over time we lose cells. If you're starting off with a really thin cortex, your risk of Alzheimer's is going to go up. This is also important for people who have Alzheimer's in their family or are worried about Alzheimer's. What can I do? What can I possibly do? Do some meditation. It's the only thing that has been shown to potentially make a difference. Okay, so in my mind, meditation is crucial for health and longevity. It does reduce medical costs, depending upon your medical costs initially. I have found it to be absolutely crucial for mental peace. We live in a very stressful world. It's not going to get less stressful. It's going to continue getting more stressful. We do know that it causes a balance in our physiology. Cortisol levels, adrenaline levels go down, endorphins go up, dopamine goes up, and it really is a way of determining what you want your destiny to be. So you don't have to go to somebody and say, I hope my destiny is going to be this on these medications doing this. You can say, I'm going to take self-control and I'm going to create the destiny that I want to have. So I want to thank you. I want to wish you all the best of luck and success in your meditation practices. Thank you.
Now we will move into our experiential portion of the practice. Let's step into it the same way as previously taught to set the practice, and we will extend to 15 minutes this week. We will ask you now to create an intention for this time of stepping into meditation, such that I am moving into this meditation practice with grace and ease. Let's review how to set your space and prepare yourself for meditation. We are telling you the same thing because we know that repetition in anything sets a practice. As you recall, the first step is to prepare your meditation space. You may call it your sacred space. When you begin your daily meditation practice, it is best to meditate in the same place every time. Sacred space is a space that you create. It is where you feel 100% safe and comfortable and may remain undisturbed. It belongs to you. Choose a comfortable chair and fill the space with things you love, things that make you feel good. Bring in a beautiful plant, crystals, or perhaps a few favorite stones. You may want to light candles or incense. Keep it simple and clean. It will be more inviting for you to come back to daily, which is what we recommend you do to build your practice. Once we have identified and prepared our space, let's prepare our bodies. we will talk about how to position our body and breath to support your best meditation practice. It will be helpful to sit up in a chair with your feet flat on the ground, or perhaps you sit on the floor, whatever you prefer. If we lay down, we may become too comfortable and may fall asleep, not making the meditation practice our priority. Not even on purpose, but the body may relax too much. Meditation is an active, intentional process, which is why seated is best. Place your palms gently on your lap, facing up for receiving. Your head and neck are comfortably straight, facing forward. Let your gaze be easy and take a few deep breaths in through your nose and out through your mouth. As you breathe, become aware of any tension within your body, and with each breath, allow that tension to leave. Allow your body to relax. In this moment in space now, the only thing you need to concentrate on is this. Everything else in and around your life does not need to be a part of your focus right now. It will all be there when you have finished your meditation. For now, let it go. Continue to focus on you and your breath, and feel your body relaxing with each breath you take. This placement of your body will help you to be aware that you are being here now in a meditation. When one sense shifts down, it strengthens the others, allowing for deeper experiencing with the remaining senses. Now your body is set and your meditation can begin in a heightened way. Sitting down and meditating in the same sacred space at the same time every day builds and amplifies the energy of you within the space, which makes it easier for you to meditate. From a behavioral perspective, you have placed this space under stimulus control. So as you return to this space daily, your body is already preparing for meditation. Have your journal and something to write with in your space so you will be ready to journal following your meditation. Even if it's only 2 or 3 words, whatever comes, write it down. Also remember to drink plenty of water before and after your meditation practice and throughout your day. Now Karen will take you into the next section of your meditation practice.
We have talked about preparing ourselves and our space, and this might be a good place to pause, reflect, and/or get up and move your body so that you'll be ready to move into the next meditation practice. Next, we have the same combined meditation where you will focus within and set an intention at the beginning. Take a few deep breaths and then move into a silent breathing meditation. As you recall, repetition sets the practice. You may have noticed that your mind and your thoughts have wandered over the past week that you've been meditating. And you've also noticed that you've observed your thoughts and returned gracefully back to the sound of your breath. And remember, with each time that you direct your attention away from your wandering mind, you are creating, laying down new neural connections and pathways which will strengthen your ability to direct your thoughts. Remember, what fires together wires together. You're strengthening this every week with consistent practice. We will begin with our simple breathing meditation. We'll do this in 2 stages, first learning to turn within to quiet the outside world, and then practicing breathing. And as you recall, meditation is an active process, not passive, so it may be best done seated, not lying down. But as with anything, you choose what is best for yourself. So first, let's turn within. Quiet your mind and your experience of the outside world. Focus your attention inward to the middle part of your being. Sit comfortably in your chair or on the floor, and let's take a few deepening breaths together to relax our bodies and minds. Breathe in and practice your diaphragmatic breathing. Now we'll breathe in for the count of 6, hold for 3, and out for 6. Let's do this 4 times. And as we talked about earlier, imagine a wave coming in toward you slowly to the count of 6, then it moves up to crest at the count of 3, and then back out to shore with your out-breath for the count of 6. I will guide you. Let's begin. Close your eyes if you feel comfortable with that. We will do 4 rounds. Breathe in, 2, 3, 4, 5, 6. Hold, 2, 3. Breathe out, 2, 3, 4, 5, 6. Breathe in, 2, 3, 4, 5, 6. Hold, 2, 3. Breathe out, 2, 3, 4, 5, 6. Breathe in, 2, 3, 4, 5, 6. Hold, 2, 3. Breathe out, 2, 3, 4, 5, 6. Last time. Breathe in, 2, 3, 4, 5, 6. Hold, 2, 3. Now breathe out, 2, 3, 4, 5, 6. Now that your mind and body are relaxed, feel yourself sinking into your chair or into the floor. Notice the muscles in your face relaxing. Release the tongue from the roof of your mouth. Feel the weight of your shoulders softening. Feel your back gently resting on the back of your chair. Feel your legs supported by the seat of your chair or floor. Feel the earth underneath your feet, grounding you. Now, as you sit in the stillness of this space, we'll begin to quiet our experience of the outside world and settle into your space. Gently breathe in and out at your normal pace, and with your next in-breath, when you're ready, bring your awareness to the middle part of your being, the part that includes your throat, chest, stomach, and abdomen. And as you focus your awareness within, you may notice something immediately or after a while, such as a sensation, a tingling, a feeling, a word, or an image come into your awareness. You may not experience anything at all at first, and that's okay too. Just sit with this for another minute and be in stillness. Welcome what comes into your awareness. Now, we have begun our practice of learning how to turn within. Before we come back, we thank our bodies for allowing us to be present within, and thank our body for sharing their wisdom and wonder with us. And with gratitude and love, we give thanks. When you're ready, gently open your eyes and return to our shared space. Notice if you felt something. Notice if you didn't, or if something was just at the tip of your awareness, but not able to be understood or felt. That is the beginning and a perfect place to start. Did you feel anything? Take a few moments to write down your experience. Now, let's begin part 2 of our meditation with a grateful heart. We have learned to quiet our mind and turn within. Sit comfortably in your chair, and for this practice, you'll breathe in through your nose and out through your mouth. This facilitates energy flow around your body. The sound of your breath is audible. We can hear it. Breathe in and out at your normal pace. During this practice, it will be normal for your mind to wander, as we mentioned earlier. When this happens, just notice it. No judgment, and return your thoughts back to the sound of your breath. Eyes open or closed, your choice. I usually close my eyes. And we'll begin by setting your intention and place it in your mind's eye. I usually start with something like, I am calm. One of my colleagues starts with, I am divine optimal health. Choose your own intention. So let's begin. I will set a timer for 15 minutes. And we begin. Now, as we finish our meditation, welcome back to our shared space. How was that experience? Take a few moments to write down your thoughts about your own individual experience. What did you feel? Thank you for sharing your practice with me. Now that you've completed week 2, you might find that you feel compelled to write down a little more of what you've experienced over 2 weeks of practicing meditation. As with practice, your experience will grow and expand. Even if it feels small, you have created a difference within your own self and with your practice. Honor yourself and reflect. Allow yourself to feel it. As we mentioned earlier, we felt called to share our experience of when and how we began meditating. So for me, about 12 years ago, I was faced with a life crisis and realized my typical ways of coping, exercise, and self-care were no longer working. I began a moving meditation practice, hot yoga and yin yoga. Both, as I mentioned, are moving meditations, supporting the clearer and more aligned movement and flow of my life force energy. I felt more balanced, and it began to change my life. I've continued to maintain a yoga practice. Then, about 4 or 5 years ago, my neighbor invited me to a meditation class facilitated by her physician, Dr. Patrick Massey. I attended his meditation class, which I found to be a perfect explanation of meditation, supported by research and science, and also explained and facilitated how to meditate during his class. I learned and began a practice at home daily. It was challenging at first. My mind wandered constantly, and I dropped off for months at a time, but then returned. I also began reading research which supported the health and healing benefits of a meditation practice, and that these physiological changes within one's body typically begin to happen at about the 30-minute mark of a meditation practice. I began again, lengthening my breathing meditation practice weekly until I reached the 30-minute mark, and then I began to feel amazing changes happening in my body, a type of euphoria and balance that I had never experienced in all my life was occurring for me. I've continued a daily meditation practice, 30 to 45 minutes daily, followed by channeled writing in my journal. I've continued to read research, books, attend spiritual training classes related to meditation and spiritual and intuitive practices. Meditation has changed my life, and I am sending the intention that you will find your answers and truth through the development of your own individual meditation practice.